In JACC, researchers report on a fascinating post-hoc analysis of the MADIT-CRT study. They analyzed the correlation between baseline left ventricular ejection fraction and outcome after cardiac resynchronization therapy by dividing patients into three groups according to their baseline ejection fraction: greater than 30%, 26 to 30%, and less than 25%. The authors focused particularly on patients who, after an echo core laboratory reevaluation, were found to have a baseline ejection fraction of more than 30%, which of course was beyond the stated eligibility criterion of the MADIT-CRT trial. Here's what they found. Reverse remodeling and outcome were significantly better in patients with baseline ejection fractions of more than 30%. In fact, reduction in left ventricular end-diastolic volume with CRT, as well as reduction in hospitalization or deaths after CRT, was directly related to increasing ejection fraction. So what does this all mean? The main message of the paper is that in the mild heart failure population, patients with low ejection fraction derive significantly less benefit from CRT in terms of reverse remodeling and heart failure rehospitalizations compared to patients with higher ejection fractions. Conversely, patients with ejection fraction in the range of 30 to 35% may well be the best responders. Second, the widely accepted concept of the relevance of dysynchrony to predict CRT response is contraindicated by these data. In fact, in this large population affected with mild heart failure, the higher grade of dysynchrony was inversely correlated with CRT response. Practically speaking, and supported by the 2012 AHA-focused updated guidelines for device-based therapy of cardiac rhythm abnormalities, patients with heart failure and an ejection fraction of more than 35% and New York Heart Association Class 2 with left bundle branch block and QRS duration more than 150 milliseconds should now be considered for preventive therapy with CRT. Thus, the risk of leaving out patients with an ejection fraction 30 to 35%, who are probably the best responders to CRT, has been dramatically reduced. I'm Peter Block, and this is a CardioSource Heart Minute.